Good morning, everyone. Welcome to our webinar this morning. My name is Beth Dehart. I'm the Director of Senior Programs here with SC Thrive. Really briefly, SC Thrive, if you're not aware, is a statewide nonprofit here in South Carolina, and we exist to help people get connected to resources to move them to self-sustainability. We offer a variety of types of trainings for people who are in the helping professions across the state. And we offer a wonderful web-based portal called Thrive Hub that is available for professionals and individuals alike who are interested in helping people get connected to primarily government benefits and some other benefits as well, like Medicaid and SNAP and others. And I would be more than happy as a representative of SC Thrive to talk to you about some of those if you're interested to learn more about that. But today I am really excited to share with you some information about an amazing service or resource in South Carolina called Welvista. Some of you may have heard a little bit about Welvista, but we do feel like it is it warrants some more discussion and some more outreach and some more letting people know about it. And I'm happy to introduce you to Rob Korn. He is with Welvista, and he is the person who's going to be teaching us today everything that Welvista has to offer. So, Rob, welcome to the webinar with me, and tell us a little bit about you.
Well, thank you, Beth. Yes, good morning, everyone. My name is Rob Korn, and I'm a community outreach advocate for Welvista. I've been with the company for a little over a year now, and we are a nonprofit, full-service pharmacy, mail order, where everything we do, we send out to South Carolinians all across the state, medications, and we have been in business for about 30 years. And my primary role here at Welvista has been to work with the Department of Corrections. We've been assisting. We have a pilot program that began last year that we assist returning citizens with their medication needs. It was a huge area of need, and it's been a wonderful aspect of my job to help and assist men and women who are leaving the prison system and going back into society. And that has been a huge part of what I've been doing. And I also am the representative that works with SC Thrive here at Welvista. And I've enjoyed getting to know them so well. And I've had a lot of business come through my hands from them. And we continue to look forward to growing with SC Thrive and helping taking care of South Carolina folks.
Thank you for that, Rob. That is one of the things that SC Thrive does is these kinds of partnerships. So we help you, you help us. We ultimately all are helping the citizens of South Carolina.
Exactly.
Rob, would you be willing to just tell everybody a little bit about Welvista generally? What is Welvista? What need are you trying to meet?
Yes, that's a very good question, because I've been doing a lot of answering the phone here at Welvista as well. And that question comes up a lot. People will call and say, I'm looking for health insurance. So we like to make very clear that our part of this is free prescription medication for South Carolina residents who qualify. I want to first share with everyone our website is at welvista.org, and you can learn a lot more by going to our website. Like I said, we've been around for 30 years. Right now, we're servicing over 21,000 South Carolinians with medication needs. If you look on the website, you'll see the amount of prescriptions we write. We have a full service, wide open pharmacy that stays very busy, and they're excellent resource and taking care of South Carolina folks who need our services desperately. And we love providing that service for them. But again, I would invite everyone to please go to the welvista.org website to look at the stats. And I want to share that we have some wonderful community partners that help us in many, many ways, financially, and also the pharmaceuticals who provide us with some free medication that we can share with folks who need it desperately. So I just am very humbled to see how many folks are involved with this type of project that you never would see or hear of. So we like to share how wonderful that part of our business is. So here at Welvista, and we'll get into a little more detail, but the folks of South Carolina who do not have insurance, low income, and who go through a process, it's a short process to be qualified, which we'll talk about in a little more detail. But the main prospect is we want to help those who need this service. We're here, and we want to help cover those medication needs that have come up in your life that we know without insurance, without Medicaid or Medicare, can be awfully expensive. And there's no cost to our services, and all of our products are shipped out directly to your home at no cost to you whatsoever.
Okay, so I have a couple questions. One,
okay,
would you spell Welvista so that anybody
yes.
can go to your website to make sure they get there?
Yeah, a lot of people try to put two L's in it. It's only one. WEL Vista, VISTA.org. And again, our website's easy to maneuver and very clear. And I'll share a little bit more as we go further into today's time together.
Got it. Thank you. So just as a summary, what I understood that you just said was Welvista is a statewide nonprofit. You serve people all over South Carolina to provide a prescription assistance for people who are uninsured or underinsured. Is that the gist of it? Okay.
That's correct.
Okay, good. And you mentioned the returning citizens with the Department of Corrections as an example a minute ago, because when they leave the Department of Corrections, they're not necessarily leaving with insurance coverage at that time. And some of those people may have medicines that they need to be able to stay healthy. So that's a really good example of that.
That's correct.
Awesome. Very good. And 30 years, you guys have been around for 30 years. I didn't realize that until you mentioned it earlier. That's impressive.
Yeah, it's been a long running company, again, based on a lot of folks being a part of this.
Wonderful. And SC Thrive is happy to be counted among those now. So yes,
that's right. SC Thrive.
So let's get into a little bit of detail, Rob. So can you tell me about, I'm going to ask you one question on two sides of a coin. What's the eligibility criteria for Welvista? And then the flip side of that is what might disqualify somebody from Welvista?
Oh, yeah. And this is very important because we have certain parameters that we've got to meet. And those are included in this. Patients who have turned 65 and are eligible for Medicare or Medicaid we no longer will be able to serve them. Now
because we do have coverage, right?
Yes.
Yeah. Okay.
Folks who come into the country who have never put into Social Security may still get served after the age of 65, but the majority of Americans will be eligible, and we are no longer able to serve after 65.
Okay, so one disqualifier is age if they're over the age of 65.
Yes.
Got it. Okay.
And also, if you've already got Medicaid or Medicare, we cannot serve you. Those organizations will have to take care of you at that point.
Because both of those do offer prescription coverage, right?
Yes, that's correct. That's correct. Yeah, private health insurance is the same aspect. That they will take care of your prescription needs at that point. Also, we will take income, and then we've got a household income level that we look at for the patient. And as long as you're not 250% over the federal poverty line, we can help you as well. So there is an income limit that we have to follow also. And it's 250% above the federal poverty line.
So you need to be 250% above or more or less?
You need to be below that level.
Below that level.
And we on our website, we'll show you if you've got 2 household members, this is the amount of gross income that you can have and still be served by Welvista up to this point.
So people wouldn't have to worry about doing that calculation themselves.
Right. They don't have to
Look
worry
up
about
on your
filling
website.
That's right. We've got that covered.
Got it.
So that part, and also, as I stated, you must be a South Carolina resident. We cannot ship outside of the state, and you must be in the USA legally. So those are the aspects to be able to be served by Welvista. You got to follow in those eligibility requirements.
And I would assume you would have to prove that residency in some meaningful way.
Yes, that's all part of the application process.
Got it. Okay. Super.
Okay.
Okay. Any other qualifiers or disqualifiers? Or are those the main ones?
Those are the main ones right there.
Okay. So South Carolina residency, no more than 250% over the poverty level for the whole household.
For the whole household.
And not having insurance elsewise.
Right. Otherwise, with Medicaid, private health insurance, or whatever.
Got it. Okay.
All right.
And I would assume, Rob, just to say, if a person isn't sure if they qualify or not, it doesn't hurt anything to apply, right?
No, all the time. We want folks to apply, and we'll go through the process. Our eligibility department will make sure that everything's in line, that we're able to help. But yeah, we still want you to apply. If you feel like you got a need, please call us. Let us work through the process, and we'll see.
So that's one of the places that SC Thrive could come in as a help, because the Welvista application is built into Thrive Hub, that web-based portal that I mentioned in the beginning.
Right.
It is one of the applications that is in there. So I want to share our call center phone number, and that is 1-800-726-8774. So if a person would like to apply for Welvista, that's where the SC Thrive partnership can come in as a benefit to you. Just call into our call center and mention that you want to apply for Welvista, and they can take that application over the phone with you. And then we will forward that information over to, say, Rob or someone else at Welvista, and they will work through the eligibility with you.
Yes, those come directly to me, and I take them from that point on through the eligibility process.
Great. Awesome. Okay. So moving on then, Rob, how many meds does Welvista carry? And are there categories or anything?
Yeah, that's a great question, because that varies. Our formulary that the pharmacy uses changes on a regular basis, where we add medications. Sometimes there are medications we're no longer able to get, or that we no longer have a great need for. And right now, there's about 170 different medications we carry here at Welvista. Wow. Over about 25 categories. Diabetic medications. Let me pull out my list here and just share a few. Central nervous system medications, diuretic, endocrine, gastrointestinal, hormone therapy, migraine, ophthalmic. I mean, we cover a large area of medications. Now, we do not carry controlled substances. So I want to make sure that comes through very clearly. But most other types of situations that you need, we've got either a medication you can use, or we'll send you a list and you can go to your doctor. He may see a substitute on our formulary list where he can take care of you, and again, get you medication at no cost.
I see. Okay, so a person isn't stuck if they are prescribed a medicine that you don't carry, because probably there's a reasonable substitute that a doctor could approve.
That's right. Then we do all we can to see if there's an opportunity for us to serve. Yes.
Got it. Just because I'm curious, are there any over-the-counter medicines that Welvista supports?
We at one time we thought about adding over-the-counter to our total package, but as of right now, we primarily just have prescription meds.
Okay. Because really, a person has access to those over-the-counter medicines on their own.
Those OTCs, yeah, on their own. Yes.
Okay, got it. Okay, very good. Let's say I apply for Welvista and you deem that I'm eligible. What happens then, Rob? How do I actually get my medicines?
All right, now that's a great question too, because it can be very confusing, because a lot of people think that they'll go to a local pharmacy or whatever, but that's not the case with us. What will happen, we'll contact you and let you know, yes, you're eligible. And at this point, we'll see, do you have prescriptions at a local pharmacy. And if that's the case, we can get our pharmacy on the line with you, and they can have those prescriptions transferred directly to us, and then we'll be ready to pull the merchandise, we'll pull the medication, and again mail it to your home. And they need about a 7 to 10 day window because we do an awful lot of business, and they do a great job of getting you what you need, especially things like for like insulin, that we have special shipping requirements. So they take great care to make sure that they get the medication you need, and where it's ready to go when you receive it.
So yeah, just to be super clear with everyone who's watching, Welvista is a program, but it is also an actual pharmacy.
Yes, we're.
Yeah, so I'm assuming you've got pharmacists on staff and people to manage, oversee.
Oh yeah, we've got full blown pharmacists, interns, and it's a place where everyone should come, and we'd love to be able to show how busy they are and how cooperative they are. I buzz them all the time with either questions or assistance that I need, and they are so helpful and so careful to take care of South Carolina residents.
Just because I'm curious, where are you located?
We're in Columbia, South Carolina.
Right.
We're on Greystone Boulevard.
Okay.
And again, a lot of folks will say, "Well, do I have to go to a local pharmacy?" No, you don't. Do I have to have an insurance card? No, you don't, because we have nothing. We don't deal with insurance. Again, all we need are active prescriptions. So we work with you and your doctor and your current pharmacy to make sure we get your medications, prescriptions here in our pharmacy, and prepared and shipped out to you.
Got it. And I appreciated something you said a minute ago, Rob. You said that you would work with the client to get their prescriptions transferred from an existing pharmacy over to Welvista, so they don't have to worry about doing that themselves. Is that right?
That's right. That's right. Yeah, we're full service pretty much all the way around. One thing that we do need to tell and make sure our clients understand, we do not reship the refills automatically. It always has to start with the patient. There'll be a date on the bottle, and if you call on that date to the number that's listed, you have 10 days of medications remaining. That way, that gives our pharmacy plenty of time to ship out your new order if you've got refills already on your prescriptions that came in. So that's a very important part of our process that we have to remind folks, because when you have a local pharmacy, a lot of times they're reminding you, and we do have a couple folks that their primary responsibility is to contact those that need to get their medication. But we're so large, we depend on our patients to let us know, hey, I'm still at the same address and I need this and this medication shipped to me. So we're in a partnership with our patients as well to make sure they get what they need.
Gotcha. Okay. So a couple other things that you said that I wanted to lift out a little bit. You said that sometimes information gets mailed to the client. And I think I also heard that there's a fair bit of phone calling between you and the client. So it sounds like if a person is applying for Welvista, it becomes very important for them to watch their mail and watch their telephone for communication from Welvista. Is that true?
That's true. And I've really tried to expand email as well. Most folks seem to have email, and it's a really nice way to communicate and to get paperwork to and from the client to us. It'll expedite becoming eligible. It'll expedite getting medication. So we're trying to use more and more tools to stay in better contact with our patients and to help them take care of their continual medication needs.
You know, Rob, you've sort of alluded to this a couple times, and I just wanted to point it out. sometimes I think people, because the process of applying for a benefit is sometimes challenging, right?
Yes, yes.
And I think sometimes people, I've heard people in my own life and history say that, oh, they want to disqualify you. They're trying to disqualify you. They really don't want you to have whatever it is that you're trying to get. And full disclosure, I don't think that's true. The process is complicated sometimes. Again, that's where SC Thrive can come in and help out, to help smooth out that application process. But I think you've indicated in several of your comments, Rob, that Welvista really wants to get this service to people who need it, and you're really trying to remove barriers as much as possible.
Yeah.
To help make sure that the people who need these medicines and don't have another way to get them can get them through Welvista.
That is so true. We try to remove the roadblocks, and it's really one of the most enjoyable parts of my job is being on the telephone and going through the process of helping somebody take care of a family member, take care of themselves. And we want to serve South Carolinians so desperately, and we'll work very hard to do it, and we enjoy it,
and it shows. That's great. Regarding eligibility, I have one last question. What about, do you have to reapply every now and then, or go through an eligibility screener or something like that?
Yes, it's an annual process.
Okay.
Like if you sign up right now on January the 1st, the following January the 1st, we're going to ask you to reapply, and we'll send out paperwork to our folks with some advance so they can get it done and not have a gap in their eligibility. So yeah, that has to be reapplied once a year because people move. We ask folks to let us know if they've moved. Please contact us with new phone numbers or emails. Contact us constantly if you've got any kind of medication changes or needs. So we really look to our patients to cooperate, to help us make sure that we're taking care of them.
If a doctor prescribes a new medicine, can they send that prescription straight to Welvista?
Yes.
Okay.
Yes.
Got it. So as long as the patient lets the doctor know that that's their pharmacy, then it can go straight there.
Yes. And a lot of clinics around the state we've got great relationships with. They will fill out the application to help the patients fill out the application forms and get us what we need to take care of them.
Got it. That's wonderful. I bet, Rob, you probably, and you sort of alluded to this a little bit earlier, I bet there are people asking you, are there other things that Welvista can provide that are medical related? So does Welvista assist with any other medical needs?
That again, that's a great question because there are other aspects, especially when they ask for things like insurance. We'll serve as a good gap if someone is applying for Medicaid or Medicare. We'll serve as a good gap to take care of the medication needs until that happens, and we're not able to help anymore. But as far as other things too as well, if they need a local doctor or clinic, we'll work with Access Health in South Carolina. We'll work I'll get online and I'll try to find a local place where they can go and be checked out by a doctor and have a relationship with a local doctor. So and also if there's a medication that we just don't have or don't have a substitute, I'll try to help them find through things like Good RX, Paycare. There are several things that are available for low cost prescriptions. So we don't just leave people hanging. As much as we can, we try to help them. If we're not able to supply it, we'll try to help them find it.
Wow, I'm so glad you all are in South Carolina. This is so important, and it just means it speaks to the heart of what you're trying to do, all this extra stuff that you guys offer to try to make sure that people get connected to their prescription medications. That's amazing. So thank you so much for everything that you do Monday through Friday, 40 hours a week to try to help with people who have these needs, Rob.
Well, it's a real pleasure to do it. It's a great need, and we're glad to be a part of the process.
Rob,
and again, have partners like SC Thrive.
Oh, thanks. Is there anything else about Welvista that I haven't asked about that you'd like to share?
Again, I just want to reiterate, go to our website. If you go down to the very bottom and click on applications and forms, we've got an 8-page application process that tells you so much about all the meds we carry. It'll list all the medications. It'll list everything about how to contact our pharmacy and reiterate what I've been speaking about. So that 8-page application is very important to understand for again, so the patient knows exactly how they fit into this and what we need from them so we can serve them better. So please look at our website and get comfortable with it so we can, again, help you take care of yourself.
Right. And 8 pages sounds like a lot. That sounds like a lot of information to get through. And
It does.
Necessary.
But it's very necessary, and it has been streamlined to try to be succinct and to the point as much.
Yeah. And all important information for sure. So let me just offer, if a person did go to the Welvista WELVISTA.org website and looked and read through the application, then you could pick up the phone and call SC Thrive, and we can help you develop your application. FYI, SC Thrive has Spanish-speaking agents at our call center, and we also can assist with people who maybe are hearing impaired or blind. We can help with any of those issues as well if you want to apply. And so we can help you put your Welvista application together. FYI, we can also help with those other benefits at the same time. If you wanted to apply for Medicaid, but you needed your prescription assistance until you get a Medicaid determination, then we could do that Welvista application and the Medicaid application at the same time. So Welvista could step in and provide that prescription assistance while your Medicaid eligibility is being determined. That would be a good example of y'all standing in that gap, right, Rob?
Yes, ma'am. That's for sure. And we have Spanish-speaking folks in our organization as well.
Perfect. So once again, our call center number is 1-800-726-8774. So tag team the Welvista website and the SC Thrive call center, and we will all together make sure that everybody gets the medicines that they need to stay as healthy as possible.
Yes, ma'am. That's what we want.
Well, Rob, this has just been a pleasure for me. So just for everybody watching, Rob and I do communicate fairly regularly via email, but we rarely get to see each other. So this has just been a treat for me. Rob, I appreciate your time. Thank you for hanging out with me in SC Thrive today. And we, again, really are privileged to be a partner with Welvista.
Well, thank you, Beth. And we are privileged to be a partner with SC Thrive.
Great. Hope this was helpful for everyone. This video will be archived on SC Thrive's social media pages on Facebook Live, on our Facebook page, as well as YouTube and LinkedIn. And as always, if you have any additional questions, feel free to call us at 1-800-726-8774. We wish everybody a wonderful day.
Thank you. Have a good day.